So now I'll be checking for the respiratory system of the patient. So for inspection, the form of chest is normosthenic. There's equal expansion of the chest of the patient during inspiration. However, I do notice a slight deformity of the chest wall. There is a barrel chest shape, and there's absence of any wounds or lesion. However, there are some signs of scar from, I guess, acne. And Shane, I'll be checking your pulse rate. Patient's respiratory rate was 18, and his muscle retraction is absent during respiration, and his nasal wing does not participate while he's breathing. Next is for the palpation. Please tell me if you feel pain. Do you feel pain?
No.
Can you please turn around? Do you feel pain?
No.
Okay, next I'll be checking your vocal parameters. Can you say 3 to 3?
3 to 3. 3 to 3. 3 to 3.
Can you please turn around?
3 to 3.
Can you please speak your hand?
3 to 3. 3 to 3. 3 to 3.
Okay, so the vocal parameters of the patient does not change. And next I'll be checking for the elasticity of the patient's chest. Patient has a normal elasticity of the chest, and then patient, can you please look up? And he has a normal position of the trachea, which is in the midline. There's no deformation of his trachea. Next will be the percussion. So for respiratory system, we have the comparative percussion. So for the comparative percussion, it has a clear lung sound which is symmetrical for both sides. And next I'll be checking for the topographic percussion. So we have the anterior border of the lung. And there is normal anterior upper border of the lung. So upon percussion, the patient has normal comparative and topographic borders of the lung. So the sound characteristic was loud and clear lung resonant sound, which is symmetrical on both sides. Next I'll be checking for the auscultation of the vesicular breathing. Can you please inhale and exhale for me? And please turn around. Okay. So patient has normal breathing. There's absence of crackles, crepitations, and no murmurs. So in conclusion, I could conclude that the patient's respiratory system is not compromised since there is no changes to the lung borders. But still, a plain chest x-ray must be done for a thorough investigation. And also, I would recommend to check for the lung capacity with using the spirometry test. And also, maybe since the patient mainly has complaints on the abdominal region, I would emphasize to do a thorough investigation on physical examination of the GIT system. And also maybe do extra specific lab tests to further help us to diagnose. And also other screening tests like ECG, stool tests, because it might be suspicion for any parasitic or bacterial microorganism, and as well as do the urine test.